During the last several years, cases of pertussis, better known as whooping cough, have been on the rise across the United States. St. Charles County Community Health Nurse Shelley Reynolds is here to help residents protect against this spread. Thanks for joining us today, Shelley.
Thank you.
What is pertussis and what are some of the symptoms?
Well, pertussis is a highly contagious respiratory disease. You know, it generally starts with a cold-like picture, a runny nose, scratchy throat. Very rarely is there a fever present. And then it progresses to a cough that just keeps getting worse and worse. Oftentimes, people will have episodes where they will whoop or gasp for air. Sometimes there's throwing up present after the episodes of coughing, but many times adults and very small babies won't have that characteristic whoop. The illness will sometimes last for upwards of 6 to 10 weeks, and that is where it gets the nickname the 100-day cough.
We talked a little bit about the symptoms for pertussis, but sometimes there's some pretty major complications. Who's at risk for those?
Well, pertussis can affect any age group, but it can be especially hard on the little ones, especially babies, because they're not fully immunized. Unvaccinated children are more likely to be affected than fully vaccinated children. And adults are responsible for transmitting more than half of the whooping cough cases to children and infants.
Speaking of adults, when we think of immunizations, we think of vaccinations and diseases, we only think that that's something that school-age children are affected by, but that's just not true, is it?
No, not at all. Many times people think that immunizations are just for children, but protecting our health really is a lifelong project. The CDC recommends a single Tdap, which is the tetanus with pertussis booster for 11-year-olds through adulthood, and especially for those who are in contact with babies. Now that would be caregivers, babysitters, daycare providers, grandparents, and this would be in an effort to cocoon or protect the babies. This is really important. They also mandate that any children that are starting 8th grade also receive a Tdap booster. It's also recommended that pregnant women during their 3rd trimester of pregnancy receive a Tdap booster. Also, many area hospitals are administering the Tdap booster before moms and babies go home from the hospital.
You talked about getting the Tdap vaccination, but how could somebody do that through the Division of Public Health?
The St. Charles County Immunization Clinic can provide the pertussis vaccine. In addition to that, other vaccines free or for a nominal fee during normal business hours. They provide vaccines every day except Thursdays and holidays. The hours are 8:30 to 11 and again from 1:30 to 4. They would just need to call to check eligibility requirements. The phone number is 636-949-1857. They can also go to our website and check out the public health section.
Thanks for the information, Shelley.